So I'm just this basically I have prepared the roadmap for 2018. Basically, this will be for a 2018 batch student, day by day, how they can plan their day so that they can clear this NEET PG 2024. I mean, that is the whole purpose.
Yes, ma'am. The most of the registrations that we have received are from 2018 batch and the post interns who
So
are
both of
preparing for May
but
2024 exam.
yes, majorly for students, it is like because their internships would be getting over now. They are confused. So how to go about sitting at home, how they can prepare. I mean, that is the basic thing which I have done.
Right, ma'am.
Perfect. Yeah, we are on the same page.
Shall we start, sir? Hello?
Just 1 minute, ma'am.
Okay, sure. Please let me know.
Shreyasi, we
Yes,
will be
ma'am.
able to see the questions. I will be able to see the questions of the students also.
Yeah, I will put all the question in the chat box, which we will receive. Okay.
And where can I see this session live to see how many students are there, what they are asking?
Actually, ma'am, there is another link for the students. They will join from this link only. So I can see the questions of the students. So I will put all the questions here in the Zoom.
So I will not be able to see or maybe know how many students are there.
No, ma'am. I will let you know all the things.
Okay.
Okay. Thank you, ma'am.
Okay, ma'am, let's start.
I can
Yes.
start.
Yes.
Uh,
Shri, ma'am,
yes,
you
yes.
want to give the introduction?
Okay. And I will hand over the session to Dr. Athul, right? Okay, so
Yes.
we are starting. So good evening and a warm welcome to all the dignitaries present here. I'm Sreshi from Clarinet, serving as the allocated session assistant to ensure a seamless experience. Clarinet stands as India's most relied upon digital platform, offering a multitude of enriching services exclusively for doctors. It is with great pride that Clarinet serves as the digital partner for this event, hosted by the Indian Medical Association Medical Students Network, Uttar Pradesh, and the focus of today's session is how to crack NEET PG guidance from gurus. So let's begin today's session, for which I would like to invite Dr. Athul Kumar sir to take over. Over to you, sir. Kindly proceed with the talk.
Thank you for the warm introduction, Sreshi. Hosted by headquarters. This will be our first national event, so we've thought to start focus on words about the Indian Medical Association Medical Students Network. The Medical Students Network is part of the largest medical fraternity in India. It is the students' wing of the Indian Medical Association. MSN has been very eventful in collaborating academic events as well as movements for the well-being of the students, which included the latest NMC strikes. We have with us today Dr. Sakshi Arora Hans. She is the leading faculty of obstetrics and gynecology in India. She's an author of various self-assessment and review books. She has been an active educator in various platforms. She has pursued her MBBS from GSBM Kanpur and her DGO from MLN Medical College, Allahabad. In her capacity as the director of GSOCG classes and many people, numerous medical graduates as well as nursing students help and achieve their academic goals. Welcome, ma'am.
Thank you so much. Thank you, Dr. Athul, for welcoming me on the stage and for giving me this platform so that I can interact with the students, I can guide the students for the most burning question, which all the students at this point of time have in their mind, that will they be able to clear NEET PG 2024 if they start now? So here I am, Dr. Sakshi Arora Hans, OBGY faculty at Marrow, author of Self-Assessment and Review of Obs and Gynae, and the latest one to my kitty is One Touch Obs and Gynae. And I am sitting here in capacity of the mentor and a franchisee owner at Delhi DBMCI, along with being a faculty at Delhi DBMCI for Obs and Gynae. So welcome, bachon. I am going to give you a roadmap to NEET PG, a step-by-step guide that how you can clear NEET PG if you are starting fresh. So I hope all of you are going to, follow these things. But again, a disclaimer, this is a roadmap. Ultimately, beta, you will have to walk on that roadmap. You will have to walk on that path. I am there to hold your hand, but the walking has to be done by you, right? So coming to NEET PG. NEET PG, this is one of the most important exam which you have to give, because this exam is the gateway to your future. Although this exam has nothing, absolutely nothing to do whether you are going to become a good physician or not, whether you will be able to do good surgeries or not, whether you will be able to treat your patients properly or not, and how much successful you are going to be as a doctor, it has nothing to do with NEET PG. But unless and until you clear this exam, you are not going to get to the destination where you want to be. So basically, this exam becomes the most important exam, because this exam is going to decide your future. This is the gateway to your future, beta. So this is one exam where your entire focus has to be. When you had done your class 12, at that time, I'm sure you were told that it doesn't really matter how much percentage you get in your board exams. But what mattered at that time to you was that you have to clear NEET UG so that you enter into a medical college. Same thing applies now. It really didn't matter what percentage you got in your final prof. What matters is what rank you secure in NEET PG. That is very, very important. Although this is one of the most crucial exams, one of the most vital exams which you have to give, unfortunately, this is the most unpredictable exam also. And all thanks to NBE for that. Right? The exam which was to happen in March is now going to happen in July. It may be taken as a disadvantage by some, but here I am to show you how it is advantage, how you can turn this disadvantage into an advantage for yourself. So I presume that most of the students who are attending this webinar, you are from 2018 batch or you are from 2017 batch, right? And if you are from 2018 batch, the question which is there in your mind at present is whether I should focus on NEET PG 2024 or whether I should forget about NEET PG 2024 because I think I'm not very well prepared for this exam, and I should put in my best efforts for NEET PG 2025. That is one of the questions which is there in your mind. Although this is a question in your mind, but still in your heart, you are unable to convince yourself that you are going to let go NEET PG 2024. You still have that hope, you still have that desire that let me give it a try. And that is why I presume you are sitting here. You are sitting here so that if ma'am can tell us some method by which we can crack NEET PG 2024, and that is why exactly why I am here to tell you that every day what you can study to micromanage your schedule so that at least you give an honest try for NEET PG 2024. होता है या नहीं होता है, we are going to leave it. That is something which will be decided later. But as of now, when you are sitting here, I want all of you to promise to yourself, I want all of you to promise to me that we are going to give a good fight. We are going to give our best efforts in clearing NEET PG 2024. Can I do it? Of course, beta. You can do it. Do you really have a choice? Do you really think that you are going to skip NEET PG 2024? You are not going to give NEET PG 2024 and directly you are going to give NEET PG 2025? Do you think that? No, you are not going to do that. You are going to give NEET PG 2024. So you can do this, and even if you can't, you have to do it. So if you have to do it, why not give it your best shot, right? So yes, we are all prepared that we have to write NEET PG 2024. That is definite. That's a definite yes. I know from all of you that you are going to write NEET PG 2024. So if you are going to write NEET PG 2024, all of you who are attending this webinar, broadly, I can divide you into two categories. I can divide you into category one. Category one would be that category where you are saying that, ma'am, I have some idea about some subjects and I'm not very although I'm not very sure about those subjects, but yes, I have a decent idea of some subjects, and there are few subjects which I have not done because I did them in first prof, I did them in second prof. By the time I came to final prof, I have no clue what I studied in first prof or second prof. That is category one student. Then category two students are going to say, no, ma'am, I don't have any idea of this course. I don't have any idea of this exam. I don't know what is a PYQ. I don't know what are important topics. And according to you, you are an absolute zero, right? So according to you, you belong to second category. I'm not saying you are an absolute zero, but that is what you are thinking mentally, that you are an absolute zero. I will come to it just now, the second category. First, let's talk about the first category. Category one, you can actually crack NEET PG. It's not give NEET PG. You can actually crack NEET PG. You can get a rank within 10,000 even if you start now. Right? I am not saying that if you start now, you can get a rank in top 500, in top 1,000. But in top 10,000, yes. Even if you are starting from now, you can get a rank. And in order to get a rank, you have to have a plan and you have to stick to it like a Fevicol or a Feviquick. That is the thing which you have to do. What is the plan? How you are going to do it? Just now I'll discuss with you. Now, category two students, all those who were thinking that you are in category two, think upon the questions which I have for you. You have cleared MBBS professional exam. Have you or have you not? Even if your internships are getting over in March, in April, you did clear your MBBS exam, professional exam, the final prof exam, you have some basic knowledge of the subject. So that is why I said, I am not saying you are an absolute zero. It is you who are feeling you are an absolute zero, although actually you are not an absolute zero. The good news for all of you is that yes, you are in the game. Even if you are thinking you are absolute zero, you are not an absolute zero, beta. Believe me. Right? Now, a burning question which you want to ask me, and if I would have been standing there and delivering this is, "Theek hai, ma'am, you are saying I will be able to do it. And I agree to you that at least I am going to give a decent try. Now you tell me, should I be sitting at home and following the source which I was following till now, the online platforms? Or at this point of time, should I go and join an offline platform?" When I gave my introduction, deliberately I told you that I am a faculty at Maro, which is one of the biggest online platforms in India as of now. And I am a faculty with DBMCI, which is one of the biggest offline centers. Right? But as a faculty, as a guru, I have to give you, you have called me here because you don't want me to sell a plan of Maro, or you don't want me to sell a plan of DBMCI. And that is, believe me, I'm not here to do that. I am here to guide you. And as a guru, what I have to tell you is, beta, you all are different. For some, online resource would be useful. You would say that it doesn't make any sense to me that I leave the comfort of my home, I go to a coaching center, I take time to adjust to their schedule, to the surroundings there, and by the time I come back home, I get exhausted. So this is not my cup of tea, right? For another student, it could be that they say that if I stay at home, no matter what, I am going to get up, no matter how much I try hard, no matter how much ma'am takes 5 a.m. sessions, I am the one who's going to get up at 8 or 8:30, 7:30. When I get up, I am not amongst those who can immediately sit to study. I will study for 1.5, 2 hours, and then my attention breaks. Then I take a break, and that break gets prolonged. And the thing which I had planned for a day, that gets extended to 2 days. So if you are amongst those who are highly self-motivated, who know what they have to do, please sit at home. But if you are amongst the second category, who feels that you need that daily dose kind of motivation, someone to tell you today is this class, from this time to this time you will be studying that, and when you'll come you'll revise and your day is done, right? If you belong to that second category, please go and join offline institutes. Now if you feel that no, I am amongst the first category, but I also need some kind of check, because I will not be able to keep a check on my progress. There are 2 ways for that. One is you join a test and discussion, right? Which is available on various apps also, which is available on offline platforms also. Or there is something unique which I have thought for you people, which I will tell you towards the end of this session, which is the highlight of this session, which is called as the hammer session, which I have planned for you people. So to keep a check on your progress, to keep you on track, there is a hammer session going to come up. I'll let you know about that hammer session. Nothing much, but something which is going to keep you in track, right? But please understand that just because something has worked for someone else, it doesn't necessarily mean it is going to work for you as well. You know your habits, you know your nature, you know your strengths, and you know your weaknesses. Based on that, you are going to decide for yourself that how you are going to approach NEET PG 2024, online, sitting at home, offline. That's totally your decision. You should not be influenced by anyone else in this decision. This is your decision. Now, once you decide how you are going to move ahead, then comes the fundamentals. We all know that there is something which is called as antepartum fetal surveillance, which tells us whether the progress of the development of the fetus is happening at the correct pace or not. Similarly, you have an antepartum preparation surveillance. The NST for antepartum preparation surveillance. What is this NST? Here, it's not the non-stress test. Here, NST stands for N for cut the noise, S for strategy, and T for important topics. I want all of you to stay during the session, because in this session, I am going to give you a day-to-day schedule. That is strategy part I will take care of. Which again, I'm saying it is not necessary you follow it. You may have your own strategy, but some kind of strategy, beta, is definitely required. You just cannot plan your studies randomly. You cannot plan your day randomly. There has to be a strategy. But coming to S later, first is cut the noise. When I say cut the noise, please separate yourself from the negative thoughts that I can't do this. That inner noise which is telling you that I can't do this, just stop listening to that. Stop listening to people who say you can't do this. Cut the noise also doesn't mean just stopping listening to people who say you can't do this. Cut the noise also means that you have to cut yourself from all social gatherings in these 4 months. Cut yourself from all the parties. Cut yourself from social media. And this last point is very important. You have to cut yourself from social media. There is a lot of noise on social media. Please cut yourself from that. Otherwise, every second day you will be in a FOMO. Oh, I am missing out on this. Other students are joining this course. This particular app has launched this course. This particular coaching has launched this course. And you will see photographs of them. And you will have this FOMO and you will end up ruining your preparation. So please cut yourselves out from social media. As I told you, strategy is something which I'm going to tell you. Then comes topics. I am going to give you a strategy where you are going to start from 1st of March, dedicated studies from 1st of March. What are you going to do in these few days? In these few days, which start from tomorrow itself, I want all of you to go through questions of previous 3 years, NEET PG and INI set. Go through those questions, note down the topics from where the questions are asked. Now, once I told this during one of my sessions that I want all of you to note down the topics, and just so to see to it that you are doing it correctly, share the screenshots with me on Insta. And I'll tell you how the student had prepared the topics. Don't do that mistake. One of the student had written, INI set May 2022, topic upper limb, 1 question, lower limb, 2 questions, abdomen, 4 questions. That is not the way I'm asking you to prepare. I want you to go into the micro details. If there is a question on bone, then which bone? If there was a question on head and neck and it was on triangles, what question was there? You have to write triangles of neck. Question was there. If it was a question on PIH, you have to write a question came on PIH, and in bracket you have to write management of PIH पे question आया था. This is the way I want all of you to prepare your own list. Either you prepare your own list, or you can, combine 2-3 of you. One of you prepare a thorough list of anatomy, physiology, biochemistry. You can, interchange or exchange those lists as well. Although these lists are available on various platforms, Telegram, Instagram, students keep on posting those lists. You can also take those lists and keep on adding to it, right? That will save some of your time. First, I want you to concentrate on previous 3 years papers. Once you are done with 3 years papers, then we can also go on to previous 5 years papers. Now comes the most important part, and that is strategy. If you are saying that you are starting fresh, right? I'm sure if you've done 4-5 subjects, if you are a post intern and you've done suppose 8-9 subjects, 4-5-10 subjects are pending, then for you people, beta, the best thing would be that till April finish all the subjects, from May start revision. But if you are starting fresh, that is, you are not confident about few subjects and you don't know rest of the subjects, right? So in that case, this is what you are going to do. This much time you are going to give to each subject. I have written every subject ke aage, I've written how many days you are going to give to it. For example, anatomy 3 days, physiology 3 days, biochemistry 2 days, micro 3 days. I want all of you to click a picture of the slide and keep it with you. Now, you can see over here, we are giving ample number of days. OBGY, we are giving 5 days. Surgery, we are giving 5 days. Medicine, we are giving 7 days. These days are not randomly divided, right? These days are divided based on the importance and based on the number of questions which come from that subject. Now, I'll tell you a trick. The trick is that in all offline coaching centers, all subjects are to be completed in 90 days, right? That is how the timetable is prepared, that all subjects should be completed in 90 days, 90 days. Now, if we follow 90-day rule in our preparation, and that 90 days is stretched over 8-9 months, right? Yahan pe you have only 4 months. Starting from March, April, May, June, only 4 months. Ab 4 months may say, if 3 months, that is 90 days you give to first reading, you will only have 1 revision. And if you are giving 90 days to first reading, that means you are reading in depth, which means you will not be able to complete even 1 revision before you write the exam. What you have to do is, you have to calculate from back. If 7th July is your exam, when I say calculate from back, 1st July se lekar 6th July tak, it is only and only revision of the important tables and volatile points which you are going to write in your 1 extra notebook, that is 20th notebook. With the concept of 20th notebook, just now I'll tell you. So 1st July se kuch nahi karna, 1st July se 6th July tak only you will be revising your 20th notebook. अब 30th June से 1st June and 30th June के बीच में should lie your second revision. And 1st May से 30th May तक should lie your second revision. So that means I have got time for 2 revisions and 1 time to go through my only 20th notebook again. Which means my entire curriculum should get over by April. Then only I will be able to do 2 rounds of revisions plus an additional round of 20th notebook by 7th of July. That is minimum what is required before you write your 7th of July paper. So that means that your entire course should get over by April. which means you don't have 90 days, you have 60 days, right? So जितना टाइम ऑफलाइन कोचिंग्स देते हैं 90 days में हर सब्जेक्ट को, I have done 2/3 of that time for each subject. And this is what the logic is there by telling you that these many days you are going to spend on each subject. When you are going to calculate this is going to roughly come to 60 days. It will be slightly less than 60 days, not more than 60 days. This will give you an assurance when you look at this, that okay, this means that in 60 days I will be able to complete one round of my reading, right? So as I said, starting from tomorrow or starting from 1st March, you have to give 60 days. March and April has to be the first reading. May has to be first revision. June has to be second revision. Till exam in July, it has to be that one extra notebook or 20th notebook which you are going to target. Now comes that, ma'am, when we are doing our first reading, what should I cover in the first reading? So in the first reading, because you don't have 7 days to complete OBGY or 8 days to complete OBGY, the entire curriculum of OBGY is going to take 7 to 7.5 days to complete. You have 5 days to complete OBGY. That is what I've given you in the schedule. So that means I am not targeting 100% of any subject. I am good to go if I have done 60 to 70% of each subject. Keeping this in mind, that I am first going to cover the high yielding topic list, which I prepared meticulously myself. So keeping that in mind, I am going to cover the topics. For instance, if question has not been asked on RH negative pregnancy, I am not going to waste my time on RH negative pregnancy. But if 5 to 8 questions have been asked in PIH, oh, that becomes a very, very high yielding topic. So my first thing would be कि cancer cervix पे पिछले 3 years में 6 questions have been asked. I am going to cover cancer cervix first. PIH पे 6 to 7 questions have been asked. I'm going to cover PIH first. Abortions and MTP पे 10 questions have been asked. I'm going to cover that first. Any topic which has been repeated so frequently, I recommend that you should be doing from your main lecture notes. Rest topics from revision video notes. So can I use revision video notes? Absolutely, yes, you can use revision video notes. But for topics which are repeatedly being asked, and that you will understand when you prepare that list yourself. Keep on putting a star mark when the same topic is repeated in every exam, and you will get that list, right? That means any topic which has got 3 or more than 3 star marks means you have to put extra effort in that topic, and that topic should be covered from main video notes. Otherwise, revision video notes are enough for all the other topics, right? Okay. Then, ma'am, you said that you are going to micromanage our timetable and you are going to tell us each step. So when I have to tell you each step, I also am going to give you a brief on how many hours you should be studying in a day. To begin with, beta, 10 to 12 hours is enough. But gradually you are going to increase it, so that once you come near the exams, that is maybe in the month of May and June, from May onwards, make sure that you have increased it to 14 hours. As of now, studying 12 hours a day will also feel a burden, because for the past 1 year, you have been on toes. You have been doing your internships. So sitting on your table and chair and studying for 10 to 12 hours will be cumbersome for you. And This is how you are going. You can easily take out time for 10 to 12 hours. I have written a bifurcation of how you can manage 12 hours in a day if you are an early riser, and how you can manage 12 hours in a day if you are a night owl. Right now, over here, I just want you to see that whether it is night risers, whether it is early risers, or whether it is night owls, you have this last slot with you. This last slot which you have with you, right? This last slot, you can keep it for MCQ practice. Theory is to MCQ ratio, time which you are going to divide. Ideally, it should be 3:1. So you have divided your 3 parts of the day for theory. Keep the last part of the day for MCQ practice. Again comes a question from you people. Ma'am, from where am I going to do MCQs? Is it going to be only PYQs? Or am I going to do the Q bank? Ma'am, Q banks are vast no matter what platform we are following. Again, beta, you are going to apply the same trick. I am going to explain it to you with OBGY example because that is what you will be able to relate, and I will be able to explain it also easily. Suppose, as I told you, questions have come from cancer cervix repeatedly in INI set. So cancer cervix becomes a very high yielding topic. That topic I covered from main video notes. And in order to know what other questions could be asked, because always remember, PYQs are not repeated as such. It is the topic which becomes important. So next time they will ask a question on cancer cervix, but in a different format. So you should be ready with those formats as well. So cancer cervix ke questions hum karenge from Q bank. Right? I am not going to solve the entire Q bank of OBGY. I am going to be very selective in solving the questions from Q bank. I am going to target the high yielding topics MCQs first. Right? Now, okay, ma'am, we've understood that how we are going to do it, but tell us which subjects to start with. Commonly what happens is, because you are slightly more comfortable with medicine, surgery, OBGY, pediatrics, orthopedics, because this is something which you've been constantly in touch in your final year and during your internships. So you tend to begin with these subjects. It's not wrong, but what happens is as you move towards the exams, the pressure builds up more and more. And if you have if you've, no, I won't say wasted, but if you have utilized your 1 month in doing refreshing all the subjects which you already did in final year, the mental pressure is so much that how am I going to do the first year subjects and the second year subject, because that is something which you've absolutely forgotten. So always try to do the harder things first and leave the easier things for a later time. And the hardest thing for you to do is first year and second year subjects. So if I was to be in your place, I would have started from first and second year subjects. A second reason to start with first and second year subjects, because May there is INI-CT exam. Although I am not confident that I can get a rank in INI-CT, I feel कि जो INI-CT के बच्चे होते हैं वो तो कुछ अलग ही लेवल होता है और मेरा तो वो लेवल ही नहीं है. That might, some of you might be thinking that. But still, if you do first and second year subjects, you will appear for INI-CT and you will see that where you stand. And believe me, if you've done your first year and second year subjects well, now, even if you are not, getting a very good rank in INI-CT, you will get a very decent rank in INI-CT, and that's going to boost your confidence for NEET PG. So start with first and second year subjects. As I have told you, the time, how much time has to be taken. for physiology, for pharmacology, for microbiology. So I will give that much of time: physiology, pharmacology, pathology, microbiology. Cumulative, when you count this comes out to be 2 weeks, 14 days. So in 2 weeks, I would have done physiology, pharmacology, pathology, and microbiology. How am I going to do physiology? The day I pick up physiology, ठीक है, उठा ली गेनोंग या उठा लिए अपने ऐप के notes या online offline class के notes. How to begin? As I told you, you are going to begin with the topics which have come in PYQs. Right? So you are going to do that. So once you do that, 2 weeks may you have done these subjects. Now, ma'am, when I do one subject, I tend to forget the previous subject which I did. So yes, that's a common problem. Second problem which you face is, ma'am, everyone is saying give GTs, give GTs, give GTs. I don't know anything. And if I give a GT now, it is going to demotivate me rather than motivate me. Totally relatable. 100% relatable problem. Right? So what you are going to do? You are going to give first subject, you are going to do physiology. Right? Then the second subject is pharmacology. Before starting pharmacology today, suppose you had to start pharmacology today. Before starting pharmacology, you will give a subject-wise test of physiology. Then start pharmacology. Once pharmacology is done, you are going to give a subject-wise test of pharmacology and then start the third subject. Okay? Understood? Now, once you have done these 4 subjects, physio, pharma, patho, micro, on day 15, because all this is taking 14 days. On day 15, that is 15th of March, you are going to give your first cumulative custom module test, where you are going to give a test made of only physiology, pharmacology, pathology, and microbiology. I am not saying give a grand test. If you are confident enough, go and give a grand test. But if you are amongst those who will feel demotivated कि अभी तो medicine पढ़ा ही नहीं है, surgery पढ़ा ही नहीं है, ma'am anatomy पढ़ा ही नहीं है, how to give a grand test? Follow this. Make a custom module test of these 4 subjects. Give it on 15th of March. Once you give a test, review the test on 15th of March. Your entire 15th of March should go in giving the test and reviewing the test. Right? Then, now comes your next subject. Ab ma'am, next subject kaun sa uthaye? Once you've done physio, pharma, patho, micro, believe me, those 7 days of medicine which you have kept, you will find it very easy to complete medicine in those 7 days. Because you have done these 4 subjects. So don't do anything at random. Strategy is very, very important. Now you are going to do medicine, psychiatry, and dermatology. Again, I have written the schedule here for you. This will bring you to 27th of March. 26th tak this all is going to get over. 23rd tak medicine gets over. 1.5 day for psychiatry and dermatology. So 26th March tak this is over. 27th March, you are giving cumulative test 2. Again, a custom module test prepared for medicine, dermatology, and psychiatry. Right? So practically, beta, when we are saying that we are doing first reading, we are not just doing first reading. We are simultaneously revising also. Right? And as I told you, after finishing medicine, give a subject-wise test of medicine. After finishing psychiatry and before you begin derma, give a subject-wise test of psychiatry. This subject-wise test you will keep on giving after completing every subject. Subject-wise test need not be of 200 questions. Subject-wise test 50 to 70 questions, good enough, right? Then comes your cumulative test, which you are giving of three subjects combined, and those subjects have to be allied subjects. So till here you have reached on 27th of March. Now comes your next set of schedule, next set of subjects. Now in this third group, I have kept anatomy, radiology, anesthesia, and surgery. Again, allied subjects together, right? By the time you complete this, again, it will be 7th of April. 8th of April, cumulative test 3. Now I'm going to go a little fast. This slides, if you want, I am going to put it on my Instagram also. So all of you can see these schedules and you can follow that. Then comes set 4. In set 4, you are doing ENT, Optha, PSM, OBGY. So beta, by 22nd of April, you have done 4th cumulative test and you have completed major subjects. In the last phase, the remaining subjects are biochem, ortho, FMT. Although I believe you can also do orthopedics with these 4 subjects. Orthopedics can be added here. Orthopedics can be done later. That is totally up to you. So very easily, you can complete everything, the first reading by April end. You can see over here, 22nd April ke baad, biochem, ortho, FMT. Biochem 2 days, orthopedics 2 days, FMT 2 days, 6 days hardly required. And you have those buffer days also in your hand. So if you plan your schedule, if you plan your day, there is sufficient time to get a decent rank, if not top 100 or top 200 rank in NEET PG. Now comes, how should I do my first revision? So from May begins your first revision. A very simple rule for revision is the number of days which you have taken to do the subject once. For your first revision, it should become half. So any subject where you took 4 days for the first reading, second reading may it should become half, 2 days. So total schedule was getting over by 50 days, around 50-56 days. First round mein, yahan pe we are going to do it in 30 days. Again, revision has to be in a planned manner. The difference in revision here is you are going to revise the notes which you had already, which you've already gone through once. Again, the focus has to be on previous year topics. Now, from May, I'm sure you will be so confident because you've done all the subject once that now is the time when you should be giving your GTs. Every week you have to write a GT now. Now there is no escape. You can't say that I don't know this, I don't know that. 100% to kabhi bhi nahi aayega na. But at least you have done them once in these 2 months. Now you have to give GTs, right? This is the time when you are not going to go for any new study material. No new classes, no new study material, no fast track revision courses at this time. This is the time when you have to revise yourself because 2 months you chose to do everything yourself. Ab third month mein sab kharab mat kar dena by running for short term courses, right? Revise what you did in those 2 months, right? Now I want you to do one extra thing other than doing GTs. That is, you have to start making your 20th notebook. What is that 20th notebook? 20th notebook is that notebook which will have important points, volatile points, which you keep on forgetting from all 19 subjects. It could be any table which you keep on forgetting. It could be any named fractures which you keep on forgetting. It could be some classifications which you keep on forgetting, on which questions are asked, but you keep on forgetting. For example, in OBGY, I always tell students, ki beta, in your 20th notebook, Bishop score should be there, right? Biophysical score should be there, because questions aayenge yahan se. Other than that, the period of just the condition of pregnancy and the time at which the termination has to be done. Make a table in your 20th notebook. Write down mild PIH में termination of pregnancy 37 weeks, severe PIH में 34 weeks, type 1 diabetes में 39 weeks, type 2 diabetes. This everything has to be written. कि किस कंडीशन में कब टर्मिनेशन ऑफ प्रेगनेंसी करते हैं, मोनोकोरियोनिक मोनोएमनियोटिक में कब करते हैं, मोनोकोरियोनिक डायएमनियोटिक में कब करते हैं, डीसीडीए में कब करते हैं. So this is a 20th notebook which will have important volatile topics. Now, this is going to vary from one person to the other person. Maybe you are the one who doesn't forget the named classifications. Other person might be forgetting the named classifications. So again, a lot of 20th notebooks are circulating on Telegram group. Please do not use them. Make your own 20th notebook, because this is the notebook which you are going to revise 1 week before exam. So you know that what are the points which you are forgetting and you want to visit them again 1 week before exam. It could be, staging of various tumors. Now, when you are doing your revision in May, again, this is the time when, because this revision is going to happen a little quicker, I believe, you should practice MCQs. MCQs has to be standardized. Every day, as I told you, 3:1 ratio mein, 3 parts of the day for content, 1 part of the day for MCQ. Same thing has to be followed in your first revision, which you are doing in May. Now, when you are doing revision in May, if there are some topics, high yielding topics, jiske MCQs you were unable to do in March and April, you should do those topics MCQs first in May. And now you should start revisiting the MCQs which you had done in March and April, and keep on bookmarking the MCQs. Okay, these are the MCQs which I want to revise next month also. Every revision when you are doing, you are filtering content for yourself. You are seeing and you are preparing for that one final day. That aim has to be kept in mind every time you are revisiting a topic. Every time you are revisiting an MCQ, that aim should be clear in your mind. Then comes from June, second revision. Again, now what you are going to do, you are going to revise the previous year topics. You are going to revise all the bookmarked questions. Again, you are going to give GTs every week, and you are going to revise your 20th notebook. Last में जो 1 week रहेगा, that 1 week has to be 20th notebook and nothing else. Right? इसके अलावा 20th notebook के अलावा PYQs, again you will quickly go through in that last 1 week. So last 1 week, 20th notebook, PYQs, and if there is any bookmarked questions which are still left. जब आप second revision करोगे, bookmark questions का number कम कर दोगे. You are going to decrease the number of questions of bookmark. And in last 1 week, that decreased number of bookmarked questions, PYQs and 20th notebook. That's what you have to do. And you have to go and give your exam. I just hope you've understood this strategy, beta. The important thing is about PYQs. So many students, they ask me that, ma'am, are PYQs enough to get a good rank? No, they are not. They are like the salt of your preparation. Without salt, any food will not taste good. But Is salt the only ingredient for a tasty food? No, it's not. So without doing PYQs, you can't even think of getting a good rank. Forget about good rank, you can't even think about clearing the exam. But is PYQs the only thing required to get a good rank? No. Right? So PYQs definitely are one of the main ingredients for your NEET PG exam, but they are not the only ingredient. Right? Now, as I told you, in the last, I'm going to tell you something, and that is something which I actually want to do for all of you, because so many of you feel demotivated at times, you feel lost at times, and you want just someone to tell you what to do. Right? And I know this is there because I have a daughter who's going to give a NEET UG, and that is the kind of thing which she is facing. She's saying, I know what I have to read, but I just need someone to tell me, okay, today you do this, today you do that. I want someone to keep a check on my progress. So here I am, because I can't help her. NEET UG is not my cup of tea, but NEET PG definitely is my cup of tea. So I can help you in that, beta. This is what I'm going to do for you. That is a hammer session. I am going to hammer you, not in literal sense, but every day, like I do my 5:30 morning sessions, this will start from 1st of March. Every day, 5:30 a.m. in the morning, I am going to be there on Instagram live with you, telling you what you have to do today, right? And seeing to it that you complete. You can just tell me whether you've done it or you haven't done your previous day's questions or previous day's course. For example, initially 3 days you have to do physiology. So 5:30 in the morning, we will meet and I will tell you, okay, you have to do physiology. Do your physiology. If possible, I will try my best, that because I don't want this thing to be limited to advertisement of any app or any coaching. I want all the faculties who genuinely want to help the student to be there with me. So if it is physiology faculty from any platform, if they are ready to come live with me at 5:30 in the morning, they can just come live with me at 5:30 in the morning, and they can tell you, okay, beta, in physiology, these things are important to do. I will try my best that for every subject, I get you a faculty who can just tell you that this is important, right? Or at least be there with you on the first day when you start physiology. I will be there, or just in case I am not available, some faculty, I have so many good friends, faculty friends, and I'm sure they will be there to help you. So if you are ready to get hammered by me, so that I can see to it that you are motivated and you do your, you finish your course on time and at least you give your 100% to NEET PG, then definitely send me a message on Instagram and we will connect from 1st of March at 5:30 a.m. You can do it. And I'm sure you all will do it. Beta, you don't have to be great to start, but you have to start to be great, right? So with this, I'm going to end today's session. I'll just show you this. This is not showing. So this is what it said. You don't have to be great to start, but you have to start to be great. So I just want to take up any queries, any questions which you have.
Hello. Thank you, ma'am. Thank you for such a detailed session. We were not expecting so many students to join, and we are receiving the reviews here that are so great. Also, it's amazing to know that how you're going out of your comfort zone and helping us all through your hammer session. It's like the cherry on the cake to everyone's preparation here. So,
No, see,
ma'am,
this is
there are
genuinely what I want to do for the students, right? Because I know this is the time when, whether you are 2017 batch, you have lost the motivation. So you've gone off track. You need someone to bring you on track. You
right.
have the content with you. You don't need someone to give you content. You just need that motivation to keep going, someone to keep a check on your progress. Most of the times, that is only what is required.
That's very true, ma'am. I remember my NEET UG times. There were my parents who were around all the time to, keep poking me to study and all. But here, when most of us are in hostels, we do not have motivation. In fact, with all the internship duties or the post-intern duties as medical officers, what happens is we get mentally drained, and we do not have any positive thought for our sessions to keep us going. But with this, I am very sure that the students will get a lot of help. So thank you for that, ma'am. So, ma'am, there are a few questions from students' side. If you can please help the students. So the first question is, ma'am, how to read textbook along with videos and the notes that the students have prepared? Because there are certain students who always have a fear of missing out because of not reading the book, not being able to read the books at the last moment.
Right. So this is basically a question which I believe the third year student or the final year student or first or second year students are facing. But the textbooks are irreplaceable. Definitely, if you are in your first year, Chaurasia is something which you have to read without reading. I mean, by BD Chaurasia, I mean to say anatomy textbooks. There are ample number of, I am not, saying that you have to read BD Chaurasia or Vishram Singh, that is, or Snell's, that is something your decision, what is being done in your college. But definitely textbooks you have to read. Now, how you are going to do that? See, when you are being taught a topic, and that is why I say my answer to this question, online or offline, varies from year to year of your preparation. If you are in first year, if you are in second year, obviously you can't go to a coaching. You will have to rely on online apps. What happens most of the times when you join a medical college, you don't know how to study that subject. When I also entered, anatomy was a big fear for me. I didn't understand how to study anatomy. For that, you should watch the video, understand what the faculty has taught to you, and then read the same thing from textbook. First, read it from textbook. I would always recommend, after watching the video, read it from textbook. Now, if there is something extra which you see that this is in textbook, but it wasn't there in the video, immediately note it down in your notes. That is how you should be doing. But this is very easy when we talk about first year and second year subjects. Why? Because first year and second year subjects, there are standard textbooks which are recommended, which are same for NEET UG, for your professional exams also, and for NEET PG also. But when it comes to final year subjects, in final year subjects, Belly and Love, definitely you have to read, right? Harrison is something which everyone can't read,
Yes,
right?
ma'am.
And then you start looking for options. And that is the time when notes come handy to you. If you can read from Harrison, nothing better than that. But ultimately, Harrison ki photographic memory banana is very difficult. You might enjoy reading from Harrison, I totally agree.
Yes, ma'am.
Right? But forming a photographic memory of Harrison is very difficult. I'll come to my subject, the problem which you are going to face in my subject. DC Datta is a very good textbook for undergraduate level. But whenever there will be a controversy in the question, for example, simple example, maximum volume of amniotic fluid is seen at. Now, your DC Datta or my DC Datta, whatever our DC Datta says, that it is at 40 weeks of pregnancy. Williams says it is between 32 to 34 weeks of pregnancy. Answer has to be marked 32 to 34. If you mark 40 weeks, that will be an incorrect answer. Right? So this is the problem with a subject like OBGY, where they expect you to mark answers which are given in Williams, to mark answers which are given in Novak's, right? But study करने के लिए undergraduate level पे they say Shaw and Datta. And that is the time when you will have to rely for your pre-G preparation, you will have to rely on notes, because you cannot go and read Williams, you cannot go and read Novak's. Even if you study textbook in undergraduate, for internship, you will have to change your source. So in that case, I think you've understood what you have to do.
Yes, ma'am. Thank you so much. Also, ma'am, like we are receiving a lot of questions in a similar pattern where the students are asking, how do interns who are working in, their facilities, 10 to 12 hours, manage their schedule between their duties and their study hours?
That's a very, very important question. And that is a dilemma which every intern faces. Interns, you will have to rely only on short material, a material which is not very vast. That is why main videos are a big no-no for you, beta. For you people, revision videos and PYQs and questions. Questions, as I told you, questions have to be restricted to the high yielding topic questions, which you are going to do during your rounds, during your duties. Just look at the questions. Once you come back home, go through the revision video notes. So for you people, revision video notes are the savior. And once your internship gets over, if you are lucky enough, like 2018 batch, you will get 3 months, 4 months in your hand. And that is the time when you will, kick your preparation, you will accelerate your preparation.
Thank you, ma'am. Ma'am, the next question is how to choose the right study platform for oneself. Ma'am, this is a question from a second year student who's
Nahi, beta. This you will have to choose. I can't choose it for you. And as I told you, every platform is unique. Every faculty has their own way of teaching. Some of you might be liking the style of Dhoni. Some of you might like Virat Kohli more. Some of you might like Sachin Tendulkar more. Right? That is how every platform is. Every platform is unique. Every platform tries to give their best. What suits you, this is something which you have to decide. So my niece, she has just now entered into medical college in Delhi. She came to me and she said that I want, which platform should I buy? I said, first you sit here, download all the platforms. Download all of them. Every platform has free videos. Watch the free videos. And see to it कि किसका समझ में आ रहा है. See, every platform ultimately is trying that you clear NEET PG. That is the basic aim of every platform. So there are some basic ingredients which are present in notes and content of every platform. It's only the style of teaching which varies. And there are some teachers with whom you can more relate to than the others. And it is not necessary also that so many times that if you choose a platform which you felt good in first prof, because you could relate to the faculties, it is not necessary that in the second prof you can relate to those faculties only, because now the faculty set would change. Right. So maybe your platform changes in second year.
Yes, ma'am.
So that is totally up to you. And as I told you, I am not here to sell any platform to you.
Right. Thank you, ma'am. Also, ma'am, there are many students who are preparing for more than one exam. Like they're simultaneously preparing for INI-SET or USM Elite Part 2. So, ma'am, what should be the difference in approach while preparing for exams like INI-SET? You just explained a good lot about NEET PG. How should be the preparation strategy different for INI-SET exam?
Agreed. So there is a very big difference between the manner in which questions are framed in INI set and NEET PG. INI set people want you to be a specialist, right? NEET PG wants you to think like a general practitioner. Now, what is the difference? NEET PG would want you to know something of everything, right? So, for example, I'll give you an OBGY example. They will, they might ask you a question on septic pelvic thrombophlebitis, which will never be asked in INI set, right? They want you to know something of everything, right? थोड़ा सा peripartum cardiomyopathy भी जान लो, थोड़ा सा this topic also. So the course of NEET PG is widespread. And as I told you, NEET PG is highly unpredictable. INI set, on the other hand, is a very, very predictable exam. Although most of the students are afraid, and as I told you, most of the students think we don't have that aptitude to clear INI set, but believe me, INI set is the most predictable exam. They want you to know some topics in great depth. They don't want you to know every topic in superficially, right? So
Yes,
again, when you are preparing for INI set, you should, the moment you do previous 3 years papers now and you write down the topics, you will see how the topics are getting repeated. Ideally, you should prepare a 5-year list of previous year topics. If that is not possible, at least a 3-year list of previous year topics, and you will see the the kind of repetition which is happening in INI set. Second important difference in INI set and NEET PG. NEET PG may 100 questions come from alone when you combine medicine, surgery, OBGY. 35, 35, 35. So a lot of stress is given on final year subjects. In INI set, stress is given on first year and second year subjects. The medicine, surgery, OBGY are important, but equally important are first and second year subjects.
Thank you, ma'am. Also, ma'am, there are many final year students who have joined today's session, and they were requesting that if you can brief them about how to start their preparation, or how to go about their preparation when they have just entered their final year. Also, how do they interrelate with the allied subjects while studying their final year subjects? Like, how do they study physiology along with medicine when they are studying
Why?
medicine for their final years?
No, beta. As of now, you are not going to do that. When you are in final year, you are going to focus on final year subjects. The biggest mistake what you do is that neither you do final year properly, and first year and second year ki tension mein you spoil your final year also. As I told you, for most of us, the exam which we are targeting is NEET PG, and NEET PG mein 100 questions are going to come from OBGY, medicine and surgery. And that is what you are studying in final year. And if you study them properly in final year, you are halfway through the preparation of NEET PG. That is what you don't understand. You don't have to do anything extra or anything special in your final year for clearing NEET PG. Because 100 questions to yahi se aayenge. Then you have SARP, orthopedics and pedia. When you combine everything, everything will boil down to 120, 125 questions out of 200 questions. So why to spoil your preparation of 100 to 125 questions? Because you have that fear that I've forgotten physiology, I have forgotten pharmacology. Now, how am I going to integrate? So your first part of the question answered. By focusing on final year subjects, actually you are focusing on NEET PG, right?
Mhm.
Now coming to the second part of the question, how do I integrate? That is the job which has been done by the faculty, whoever video you are following.
Yeah.
I am pretty sure across all platforms, there won't be any surgery faculty who will start teaching you about gallbladder or about pancreas or about stomach without taking you through the anatomy or without revising the anatomy of these things, of these structures. Across all platforms, I don't believe that there is going to be a medicine faculty who's going to start cardiovascular system without revising the cardiovascular physiology with you. So when you are watching the video, that is already done for you, right? And here, not because I want to influence you, I can be 100% sure that this is done in MARM. Dr. Rakesh
Mhm.
Nair has integrated everything in medicine. Dr. Rohan has integrated everything in surgery. In OBGY, I have integrated everything. OBGY का मतलब है कि pharma integration भी वहीं पर है, patho integration is there, medicine integration is there, every integration is there. So you don't
Yes.
need to do anything, right?
Mhm.
So that is something which leave it on the faculty. They are doing it for you. When you watch the videos, that part is taken care of.
Okay. Thank you so much, ma'am. Ma'am, the last question that the students have is that many of them are using first aid
Oh
for
yeah.
preparations. So, ma'am, how do they use it in the most efficient manner while preparing for NEET PG? The first aid book, which comes
Uh,
for Emily.
you are a first time user of first aid, it is difficult that in these 4 months you will be able to annotate first aid, right? You can try in first aid. Step 1, you have subjects like microbiology, which is very good in first aid, biochemistry, which is very good in first aid. So what you can do is, when you are doing, if was this question asked by a student who is just now in final year or the one who has to appear for NEET PG 2024? I want to first know that.
Ma'am, the student is a third year student.
The student is a third year student. Okay. So in that case, beta, when you are doing microbiology, when you are doing pathology, right, from the main videos, you will see that first aid is not giving you any explanation. If you are a first time user of first aid, you will not understand first aid as of now immediately. First aid is giving you all the important points at one place. It is not explaining you the subtopic. So you are going to watch the video. For example, you have watched the glomerulonephritis, right, from pathology. Now you will see that when you go to first aid, there will be a table which will be made for glomerulonephritis. So you understood the topic from the main video, right? You read the main video notes and you will see that it has been beautifully summarized here. Now, any point which you feel add on should be there. This point was missing in the table. If you
Mhm.
can immediately add it there and then. But don't use it at the first time. First understand the topic and then go. It's like everything concised and presented to you so that you don't have to go through pages and pages of notes. But that will not help you to clear your undergraduate exam,
Okay.
right? That is purely for PG. When you
Right.
have to write an answer, explain an answer, you will have to either follow your Robbins or your notes.
Okay. So it's basically like a reference book for students.
Absolutely a reference book.
Okay. So, ma'am, I do not think that there are any more questions. So let us conclude the session, ma'am. Do you have anything, any last words to say?
Yeah, my last words to you people are, beta, you are capable of achieving all the dreams which you have seen till now, right? You don't think that I am not capable. Don't carry that self doubt with you. Start with a positive note, right? And manifest positively that you are going to clear the exam. And I'm sure with the right kind of strategy and with the right kind of attitude, you will definitely clear the exam. And I am there to hammer you, to see to it that you are following the right strategy, you are on right track. So if you are in for the hammer session, do ping me on Instagram.
Right. Thank you
Acha,
so
just
much.
I would also like to say something. Thank you so much to all the organizers of IMA MSN Society. This is a wonderful work and a wonderful initiative which you all have taken. Right. Thank you to the moderators, Dr. Akshat, Mittal, Dr. Athul. Thank you so much. Thank you, Dr. Arjit and Dr. Rushikesh. Right. So
Thank you, ma'am.
without you people, so many students would not have been able to attend this session. Thank you so much.
Thank you, ma'am. This
Keep doing.
session, yes, this session, How to Crack NEET PG Guidance from Gurus, has been a big success. We have received 800 plus registrations, and right now more than 400 students are here with us in this session currently. For this, I would like to present a warm gratitude to you, ma'am, who took out precious time from your busy schedule for this session. Your thorough and detailed presentation clearly reflects how seriously you took this and the amount of time that you must have put in this presentation. Nextly, I would like to thank National President IMA, Dr. R.V. Ashokan, sir, Honorary Secretary General Dr. Anil Nayak, sir, National MSN Chairperson Dr. Shalabh Gupta, sir, National MSN Convener Dr. Akshay Yadav, sir, National JDN Chairman Dr. Abul Hassan, sir, National Convener of MSN's National Council Ajit Bansal, sir, National Secretary Dr. Rishikesh Shukla, my co-moderator Dr. Athul Kumar, sir, Dr. Suryam, Dr. Pritish for managing the technicalities. Lastly, I would like to thank our digital partner, ClearNet, for the seamless connection and managing all the technical aspects of this session. Also, I would like to thank all the students who joined and for their patient listening. Thank you so much, everyone. Thank you so much,
Dr.
ma'am.
Akshat, I have a question. Will this recording be available to the students to refer to it?
Yes, ma'am, we can definitely have it on our Google Drive through our digital
How
partner.
can a student access this if they want to, see the schedule, the all the number of days which I had given them, and how can they come back to it?
Ma'am, I'll have to talk to Miss Shreyasi.
And
Miss Shreyasi, can you please help
we'll
with that?
collaborate with ClearNet and we'll release a poster for that, ma'am.
Great.
Yes, so we will share the videos.
Okay, the other thing is that if the students want this schedule, and if it is okay with you all, I can post this schedule on my Instagram handle also, so that they can follow this roadmap to NEET PG.
That will be very helpful, ma'am. Thank you so much.
Okay, take care. Love you all the best.
Thank you so much, ma'am. Good night.
Thank you for your time.
Thank you so
ma'am.
much. Thank you
Thank
so
you.
much, everyone. Thank you. Good night.
Thank you, ma'am. Good night. Thank you.